Hello, I'm Gary Bain, and welcome to Wound Guy Conversations. Today we're talking with Melissa Freeman, so let's come and have a chat.
My name is Mel Freeman. I'm a clinical nurse specialist in wound care, and I own and run my own nurse-led clinic on the mid-north coast of New South Wales. And we attend to all wound care, continence care and primary health care within our clinic and within the region. I've worked in nursing and healthcare since the late 1990s when I went straight into nursing from high school. I've always been very interested in wounds and wound healing, and I worked in emergency, acute medical wards, also did rural and remote training, and most recently I worked in emergency and anaesthetics. So I would see wounds coming in from when they would happen, and then also get to follow them right through to surgical debridement or flap repairs within theatres, and I always found it super interesting. When I left the hospital setting, I went to start my own nurse-led service, and then that has been around for the past 6 years. So I've had lots of years of exposure and experience, and I've really enjoyed working with wounds. The most significant challenges that I find in my own practice with my patients, and also practice within our own clinic, is a financial strain on people with chronic wounds. As you all know, there is over 450,000 people living each year with a chronic wound, and the challenges that often patients face are the financial strain. The cost of consumables, the cost of care, the limitations on funding streams for patients, and what they have to go through to be able to access that funding is something that I find extremely challenging, and so do the patients also. My most important piece of advice to someone that is freshly learning wound care would be to take time to communicate with your patient. We are so blessed to have the time that we have in caring for our patients while doing their wounds. Take the time to ask questions, but also give time for the patient to answer their questions comfortably and openly. Provide a safe space for the patient to tell you about what's worrying them, about what they understand about their wounds, and look at a teach-back method so that when you're teaching self-care to your patient with wounds, ask them, can you tell me how to do it? Can you tell me your understanding? Because patients' health literacy varies incredibly. So make sure that when you're providing information or instructions or directions to your patient, make sure that it's appropriate and adequate for your patient's health literacy standards. If I was to have a conversation with a politician about how wound management and wound care can be enhanced in Australia, there's a number of issues that I would raise. Firstly, and most importantly, it would be to expand the access to free wound care for all patients that are at risk or are experiencing chronic wounds, not just a certain cohort. Secondly, I would include ongoing clinical and educational support to all nurses working within residential aged care facilities and primary health centres across Australia. This would also include ongoing education and access to upskilling and further training for those clinicians. And lastly, would include world-leading research into wound care to be conducted within Australia. Yes, I do have a few favourites in regards to textbooks and journals. I find that wound care is constantly evolving and changing, especially with new products, research and technologies that are coming out. So I do tend to lean on 3 publications that are my text. However, I do keep up to date through my normal search engines in regards to research and peer-reviewed journals. My 2 go-to textbooks are the Wound Care Essentials. This one is really good with photos, descriptions, and tips and tricks that you need. The next one is the Wound Care Nursing Textbook, which is from Sebastian Props. This is very nursing based, which I find extremely relevant to my clinical practice and care within our clinic. And then the next one, which is my favourite, is the Wound Practice and Research through Wounds Australia. This comes out quarterly with your membership, and I have found that has provided me with so much information that I have found extremely relevant and up to date. Yes, that's correct, Gary. I am a very proud member of Wounds Australia, and as Australia's sole peak body for wounds, I find that there is a lot of benefits. Members can receive the Wound Practice and Research publication quarterly. There is our national guidelines, which all wound clinicians should be practicing by. You have peer support, you have constant contacts that you're able to gain advice and resources from. There is education opportunities, there is heavily discounted conferences and events that you can attend to. The biennial wound conference, which is such a great event. It's a huge few days of information, networking, and general support from your colleagues. It's so nice for us woundies to be within the same room at the same time, being able to chat, being able to meet each other in person, because we are so vastly dispersed across the country. And I found that I gained so much knowledge just from those few days. I was involved with the committee as well, so there's lots of opportunities for you to upskill, take on different responsibilities within the wound world and have your say. You're able to contribute to the wound world as much as you choose to. So being a member of Wounds Australia has definitely brought me so much to my career, and I'm extremely thankful for the position that I have. I think I have to say that this is my favourite question so far. I find that the key to effective patient communication is time. To be able to sit with a patient and listen to them and communicate while we're doing their dressings and their wound care is a gift. We are really privileged to have the gift of time and to use it effectively. The best part about communication is listening, and it helps to make sure that your patients feel safe in a space where they have time to be able to answer. Within the roles in hospitals, you often don't get the time that we have in community or primary health settings to be able to sit and enjoy a conversation with your patient. My advice would be to make sure that the communication method that you're using is appropriate for someone's health literacy levels. If you need to use pictures, resources, anything else that may help someone to understand their advice that they're receiving, go for it. There's no rules in regards to communication. When you are communicating, you communicate in the best way that it's going to be absorbed and going to be listened to. Sometimes I use the teach back method, so I teach a skill or I teach something to a patient and ask them to read it back to me in their own understanding. Sometimes they could draw pictures or show me pictures of how they understand, and I never ever try to fit a round patient into a square hole or a square clinical pathway. For effective communication, you need to make sure it's individualised and make sure it's appropriate for them. I have had so many moments of joy over the years doing what we do. I guess my proudest time within our clinic was expanding to have an on-site clinic, like you can see here. Opening that was really exciting for us, as previous to that we were a home-based service, so we would go out to see patients within their own homes. I guess what gives me the greatest joy internally is the fact that I work with such a great cohort of staff. My staff don't work for me, they work with me, and we get to do some of the greatest stuff out in the community and here as well. I trust my staff to look after my own family, so I know that when our patients are cared for, they're cared for people that genuinely love their job and genuinely love what they do. Professionally, my greatest joy would be the work that I've done with Wounds Australia over the past year. I've been a member for many years and been involved in different projects over the years, but this past 12 months has been huge for us. Just recently we filmed the National Wound Awareness campaign, which will be rolling out in part of the chronic wound consumable schemes with their wound awareness campaign. So that is really exciting to be able to come out, and the information is going to be targeting the people that need it the most, which is patients. So that will be a very exciting thing to see come out, and I'm extremely proud of what we've achieved so far. I think that time is of the essence, and I think that things will only improve over time. It's a great time with primary healthcare and wounds at the moment, being at the forefront of political conversations and also scope of practice. And being involved in numerous projects in that regard is also a really big moment of proudness for myself. Thank you.